I want to welcome all of you to our September 19th press conference of the North Carolina State Health Plan. Behind me, I'm joined with a lot of the staff that have worked tirelessly over the last few months to get our TPA, which is our third-party administrator contract, out on the street, and also after that was done to score those. We're very pleased to announce today that the winner of our TPA contract is Blue Cross Blue Shield of North Carolina. In just a few moments, you're going to hear from Dee Jones, who's the executive administrator of the plan, as well as some members from Blue Cross. I want to say, before I hand the mic over to Dee, that there were several bidders in this process, and I wish to thank all of those for their participation in this, the tireless amount of professional hours that they put into submitting a bid to serve the people of our state. One of those bidders, it's no secret, is United Healthcare, and United Healthcare continues to offer coverage for over 75% of our retirees through our Medicare Advantage product. We look forward to a continual and prosperous relationship with them. This announcement today is not a renewing of our vows with Blue Cross. It's a resetting of our priorities and our relationship. There's a big difference. We are going to be reducing complexity for the state health plan going forward and building value for these participants. Instead of talking about data going forward, we're going to have data that talks to us. Previously, I think there's been a frustration in the entire medical community about the fact that we are not using data to the benefit of the participants of this plan or the taxpayers. We do know that this card, this coveted state employee health plan card, is one of the most coveted health plan cards in North Carolina. Providers like seeing people with this card. Hospitals like seeing people with this card. And we want to make sure that even though they have their business to run, we also have a business to run on behalf of our participants and retirees. I'll also say that no matter what you're wearing today or what you drove into this building, that generally speaking, you can tell me exactly what you're wearing cost and what the car you drove in here cost and what the last tank of fuel that you bought cost. Healthcare is something that our members consume on a daily basis. Even after they consume it, there's a question about the value and the cost of what it is they received. I show this explanation of benefit to you. This is something that our members get in the mail constantly. This is an explanation of benefit that's almost 2 pages long, and every single thing on there says facility charge and gives no insight as to what the person paid for. So I'll end where I started earlier. This is not a renewing of our vows with Blue Cross or with the medical community of North Carolina or the providers, and to some degree even our pharmacy services. This is a resetting of our relationship. We are dealing with a situation with the state health plan where we need our participants not only to be our watchdogs, but also to take personal control of their health care. And that's what we're going to be focused on over the life of the contract that we just awarded to Blue Cross Blue Shield. This is a serious matter. It's a matter that was going to face the next treasurer in North Carolina if it had been my predecessor or my opponent or myself. It's not emotional, it's not political, it's mathematical. So with that, I'll hand that over to Dee Jones, who's the executive administrator of the North Carolina State Health Plan. Dee.
Thank you, Mr. Treasurer. Again, my name is Dee Jones, and I'm the executive administrator of the State Health Plan. I'd like to start by thanking our core team, led by Ted Enerson and Caroline Smart, for leading the TPA RFP effort, along with the many subject matter experts who provided their extensive knowledge and substantial time throughout this lengthy process. Beginning with the RFP planning and development stage, which started in early 2016, through the detailed review of 17 sections and thousands of pages of technical information leading up to today's award, their professionalism, integrity, commitment to, and respect for the process is to be commended. Supported by the Treasurer's leadership and the efforts of the team, I am pleased that we are able to stand here today with our partners for the coming years to provide a health plan forged in quality and value for our members. Now that we've completed the RFP process, we look forward to beginning work on the 2019 implementation effort. We'll work diligently for our members to gain efficiencies and reduce complexities as we design the plan benefit program for 2019 and beyond.
Thank you. Good afternoon, everyone, and I will keep my comments very brief. I can't tell you how happy I am to be working with the Treasurer and the State Health Plan as we help them to address their priorities and their goals moving forward. I agree with Treasurer Folwell in that it is a new day, and we're very clear about what the priorities of this office are, and we look forward to supporting those. I also want to say that we are incredibly honored to continue to serve the employees of the state and their families. So, again, we take that responsibility very seriously and could not be happier. So, thank you, Treasurer Folwell, Dee, and staff.
Thank you all, and we'll be glad to open it up for questions. Rest, Rose.
The woman who spoke just before you, what is your name?
I'm sorry, my name is Susan Murray. I'm the Vice President of the State Segment at Blue Cross Blue Shield of North Carolina.
Is that A-Y?
A-Y, yes.
That's the easiest question I've ever gotten from you, Rose.
Me too.
So,
Whoa, next.
This is one a hard one,
No.
or a more complicated one. So right now, Blue Cross, you're currently in this tug of war with Mission in the westernmost part of the state. Potentially, Blue Cross might not be contracting with the largest vendor of healthcare in the western part of the state. How might that affect state employees out there in the mountains?
Okay, I presume you'd like for both of us to answer that. Okay, you go first.
So that's an accurate statement that we are, we aren't actually currently in negotiations with Mission, but we do have an issue going on with Mission Healthcare in the western part of the state. We would be happy if Mission rescinded their termination notice. They have not done that to date, so that is something that we would love to see. There are other alternatives other than Mission Health in the western part of the state, and we have provided the state health plan as well as our other clients in that part of the state with information about the other health systems and providers who are available there.
I would add to that, the people standing behind me and elsewhere in this building are keepers of the public purse. And generally, people assign that term to us being the state bank or managing the state pension plan or the defined contribution plan. We extend that to being keepers of the public purse as it relates to the state health plan also. We are obviously understand that we have a lot of participants who live in that part of the state and that their choices are limited, based on geography. We will be working very closely. I have spoken to the incoming announced CEO of Blue Cross. I have spoken to the president of Mission Health, and obviously they have their business to run, but so do I. And my business is for accessible and affordable health care for state employees. And we're not going to be misdirected from that mission. No pun intended. Yes.
Mr. Treasurer, it says here that the proposal that BCBS offered was essentially flat in terms of administrative costs. Since I don't follow this all that closely, how is that paid out? Is it per member per month? Is it a portion of the monetary claims? How does that work?
Great question, Gary. Thank you. It's paid out as a PMPM, which is per member per month. It gives me an opportunity to explain to you and the rest of the viewing audience, Blue Cross Blue Shield is not our insurer. We are self-insured. They are our third-party administrator. And I know that's a common misconception out there among our state employees, retirees, and the general public. And so we get charged on a per member per month basis by Blue Cross Blue Shield to administer our employees through their networks.
Follow-up, can someone provide me specifics on what is the current per member per month, and what will it be under the new extended contract? It's probably not easy, I'm sure.
Okay. Generally speaking, we're looking at it's only complicated by the fact that we're rolling in our population health management into this new TPA, and separately it was separate. So to give you an accurate answer on that, I would probably need a little more time. If anybody on my staff would like to chime in on that, they'd be happy to. But I would say that it may be a slight decrease is my intuition after going through all the materials today. I mean, a slight decrease, excuse me. Yeah. Yes.
There have been some concerns in the past about Blue Cross's being a transparency. There were some calls a few years ago for your company to be more transparent in terms of contracts. Obviously, I'm guessing this is not a no-bid contract as was back in, what was it, 2010, 2013. There's a lot of criticism about that. What are you, have you folks, has Blue Cross made a commitment toward more data transparency, more price transparency with the state?
Yes, as a matter of fact, we have full data transparency with the state health plan and have now for several months been providing the state health plan with claim data files that include all of the aspects of a claim, including the provider information. So there is full data transparency from that perspective. And I would say more generally speaking around transparency, Blue Cross Blue Shield has a public price transparency tool that is available. It's available to our members as well as to the general public that provides price information on a wide variety of medical services.
Rose, I will add to that answer that the basis under which I come in on a daily basis regarding the state health plan, the foundation of a lot of the things that I'm going to be working on go back not only to the less merit audit of 2008 on the state health plan, but also the Auditor Beth Wood audit of 2011. And it talked about transparency, it talked about contractual relationships, it talked about overpaying. Those are very important issues to me. The second piece of that foundation is things that have been given to us, for example, by CENIC, State Employees Association, things that they are generally concerned about regarding transparency. It's real easy to stand up here and tell you that we're being transparent. But the fact is if the data doesn't talk to us, it is worthless. And I can assure you that in my term as the treasurer, that data is going to talk to us. We need to be able to empower our participants about the cost of what it is that they're consuming, not just their cost. We need our participants, when they get one of these things in the mail, not just to go to the last entry where it says how much you owe. That's not what we need. We need people to dissect and look at these explanation of benefits to make sure that they're not paying for procedures and supplies and other kinds of things that they did not consume. Okay.
Does this mean that Blue Cross Blue Shield is going to participate I know there's been some talk in the Institute of Medicine about a payer claims database. Will you folks be participating in that?
Rose, I am not the best person to address that, so I'm not even going to attempt to do that. But I can certainly get a more thorough answer for you.
Other questions? As I close, I want to thank the Board of Trustees of the State Health Plan. We have a good mix of new board members and board members who have had some history with the State Health Plan. I say that because some of the issues that I talk about with you, I'm parroting things that are of concern to them. This vote on this third-party administrative contract was unanimous, and we look forward to carrying out the State Health Plan Board's mission in terms of reducing the complexity, building the value, and the sustainability of this plan. We received a report a few months ago that talked about the long-term liability of this state health plan was $42 billion. If you divide that per capita and you compare it to Illinois, which everyone talks about along the lines of these issues, we're right behind Illinois in that regard. This is a serious matter where people have been eligible for health care, but no money was ever put aside for that purpose. And when you're on a pay-go basis, that makes it extremely difficult. In addition to that, we think that we have enormous opportunities. We are spending almost $1 billion a year on prescription drugs. In so many instances, we are the price taker. We're the price, somebody else is setting the price on those drugs. We need to be more diligent about that. Secondly, common to everybody in the state, regardless of who they work for or who they retired from, we have a pharmacy adherence problem. We have people who take a piece of paper from a doctor and they never get it filled. They get it filled, they don't pick it up. They pick it up, they don't consume it. They pick it up and they consume it partially. And then that fifth category is they do all the above and they consume it exactly as prescribed. There is a lot of waste in those first four steps, and we need to make sure that our state employees and retirees are serious about when something is prescribed to them that they take it as prescribed. This is very different than most things that you consume. If you go to the doctor for bronchitis, for example, you get charged. If you go back to the doctor 4 weeks from later and you still have bronchitis, you get charged again. I mean, we are going to be more diligent about things along those lines. So, yes.
I'm sorry, I have one more question.
Mm-hmm.
Is that okay?
Yeah.
Did Blue Cross, did you sort of talk about savings goals? Did you offer savings goals? Did you guarantee anything? Did you folks demand a savings goal and, in this new contract?
So I'm actually going to look at D and the treasurer to answer that. There were specific requirements in the RFP that we addressed as part of our response, but I would look to these folks to provide any specifics they'd like.
So, thank you, Rose. As we go through the process of setting up the plan design and the benefit designs coming up, we'll be deciding which of the savings opportunities we might want to take advantage of, because they range from changing the way the network works to to more tactical items. So it's not something we know right now, but over the next 6-9 months, we will be making those decisions.
And one last question.
Mm-hmm. Well, let me just add to what Dee said. We have to find a way to take $300 million a year out of our health care spend. The amount of money that this state health plan spends, which includes employee money as well as our money, the amount of money that we spend exceeds the entire appropriation to the UNC system this year. and it's going that way. The challenge is that our prescription costs are going up 6 to 7% a year. Our medical costs are going up 5 to 7% a year. But both the governor's budget and the General Assembly's budget only funded us at a 4% increase. Not to be confused with the pension plan, which they fully funded, plus tens of millions of extra. So our need to cut $300 million out of the cost of this $3 billion a year operation is not just something that we thought of. It's a necessity. And it's a necessity in order for us to sustain this plan. In addition to that, we have to do this in a way where we're working with the stakeholders of the state health plan. These folks know a lot about what's going on and where the costs are and where the waste, fraud, and abuse exist. We need to listen to them, which we do. The second reason that I bring this chart to your attention is that we are, as I said earlier, we are on an unsustainable course in terms of the amount of money that this plan spends. People obviously are living longer. That's a blessed event. So the amount of money leaving the plan every 30 days only grows. So we're going to do a better job of rationalizing and cutting costs inside the state health plan, both with medical services and pharmacy benefit services. Now, what that means is that's going to be a partnership. It's going to be a partnership between us, our third-party administrator, and the providers of these services throughout the state. And that's where my optimism comes from. I think that we have a unique opportunity to lead the nation in this regard. I'll also add to that we may be one of the few states who even has a shot at actually solving these long-term problems. That's where my optimism comes from. Any other questions? I want to thank everybody for coming out. Frank Lester is in charge of communications. We'll be glad to help you in any way going forward if you need information or data. I want to thank our team for not only putting out the RFP, but sitting in a what's commonly described as a war room for 17 days. More? For weeks at a time, at 8 hours blocks. And when you go through something that has thousands of pages in it by multiple applicants, scoring this stuff is very important. Now, the hard work begins. We're now in the implementation phase. We have awarded the contract. Both parties have signed the contract. Now we're in the phase of actually how we're going. Now the technical part is behind us. We're going to talk about how we actually build and design this state health plan in a way that it is sustainable. Behind most of our state employees, faith relationship, their relationship with their family and their health, for over 1 out of 10 North Carolinians, the next two most important things in their life come out of this building, which is their pension and their health care. And as keepers of the public purse, we take that very seriously. Thank you, and thank you all for coming.